Welcome to an introduction to private insurance terminology. In this lesson, we'll review insurance terms you'll need to understand in order to bill an insurer. After completing this lesson, you'll be able to define common insurance terms. Understanding insurance terminology will help you to relay correct information to your patients. We'll now run through some of the important terms you'll need to understand. When you need a refresher, refer to the downloadable job aid called Insurance Glossary. A deductible is a specific dollar amount a subscriber is responsible for each year. The amount varies greatly from plan to plan. Before the plan will pay any expenses to a provider, the patient must pay their deductible amount to qualified healthcare providers. When the amount has been met, the plan will begin to pay the contracted amount for services. The health plan tracks the deductible amount by monitoring submitted claims. Keep in mind that some preventative services may be available without patients having to spend any of their deductible. It's a good idea to check with the patient's health plan to make sure you're following their rules. Co-payments or co-pays refer to a specific dollar amount that the patient is required to pay for office visits. The amounts vary greatly within plans and are often different for primary care providers and specialists. For example, a patient's copay for a doctor's visit might be $25. The same patient might have a $35 copay to see a specialist. It's important to understand that the Affordable Care Act requires health plans to cover routine ACIP-recommended immunizations without any copayment or other out-of-pocket costs. Coinsurance is a specified percentage that the subscriber is responsible for after the deductible has been met. The percentage amount varies by plan. Coinsurance typically applies to non-office visit services such as lab work and x-rays. Patients seeing a provider outside their regular health plan are more likely to pay coinsurance. Typically, coinsurance is paid on the day the patient receives the service. However, your department may have protocols for arranging the payment later or working out a payment plan. Here's an example showing 20% coinsurance, meaning the remaining 80% gets paid by the insurer. Let's say after visiting the physician, Mr. Andrews goes to a separate facility to have lab work done. The cost of the lab test is $50. Mr. Andrews' insurance plan pays 80% and leaves a 20% coinsurance for the patient to pay. Assuming Mr. Andrews' deductible has been met for the year, he will owe 20% of the $50 total cost or a $10 coinsurance. He pays this to your clinic. The $10 that the patient paid also needs to be documented to the insurer so it will count towards his annual cap on out-of-pocket expenses. Mr. Andrews' health plan covers 80% of the total cost, or $40. Together, these two sums equal the full cost. You'll bill the patient's insurance company for the full $50, understanding they will pay their 80% share, or $40. Later, the insurance explanation of benefits will explain that the $10 was deducted since the patient already paid that amount as coinsurance. Most plans have an out-of-pocket maximum amount that the patient will have to pay per year. When this amount is reached, the plan typically pays 100% of covered expenses for the remainder of the year. Historically, insurance companies could choose the maximum amount of out-of-pocket costs that a patient must pay in a given year. Some plans had no limits. Beginning in 2014, the Affordable Care Act establishes an overall out-of-pocket spending cap of $6,350 for an individual and $12,700 for a family. Those totals include co-payments, co-insurance, and deductibles, but not monthly insurance premiums. The private health insurance system and the law are complex. Exceptions may come up, so be sure to check with each plan about their out-of-pocket maximum rules. Now please follow the instructions to take the quiz for this lesson. It will look familiar. It's the same one you took before viewing the lesson. This time, you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered, so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.